Okay, boom. I just passed my third year of medical school and I just started my fourth year, and I wanted to make a tier list on the different subjects in the year on basically the hardest to easiest, easiest to hardest, blah, blah, blah. First, I'm going to go clinical dietetics, stinker class. Basically, you learn about different diets, and you learn about what's it called, the effects on people, and also you learn about some pseudo diets that people talk about, and also the things that people will be missing in their different diets, blah, blah, blah. Things of that nature. You understand clinical dietetics. Boom. Next, I just put them together. Surgery, dentistry, and oncology. Propaedeutics to these subjects, by the way, which is like an intro. And they're pretty similar where they have a couple seminars, a couple lectures, and then you take a test. Like a medium test, right? Depending on the semesters you have maybe one or two tests, which is fine. It's pretty okay. You show up, listen in class. So for the test, it's usually old questions, but if you depend on them fully, you're cooked. So study, but also you're probably fine. And actually, I don't think oncology had a final test, which made it easier. And I think they go in the meh because they're pretty meh. Propaedeutics in radiology. I put it also with that propaedeutics with the meh. Just meh. It's okay. The test is easy because we have a couple lectures, a couple seminars. It's the same thing basically. And we actually have like a test that I remember well. And it's pretty okay. Just pay attention in class. You'll be fine. And it's old questions also. And you study a little bit, but it's mainly old questions. Just come to class. You'll be fine. Next one, Propaedeutics of Internal Medicine and Propaedeutics of Paediatrics. So I put these together because even though they're bigger subjects, like they last the whole year, they are pretty similar also. So that's why I put them together. They both have lectures, seminars, in-person classes, presentations. Did internal have presentations? Like in class, you have presentations, right? Yeah. So there's presentations, many little projects like that. You're gonna prepare some topics to talk about. These are bigger classes though, where you learn how to do taking patient history from adults and kids. Of course, internal is basically just pediatrics, but pediatrics just includes kids and some more factors including them. So yeah, that's what we get. We build our base of practicing, asking for physical examination. Asking for patient history and taking the full body examination, head to toe, applying our stuff that we learned in different classes, and we actually get to see the differences and we get to see some cases, right? Because we're in the hospital. I like to break it down where the first semester you're doing full body amnesis or history, full patient, and then you also do second semester was more focused on full body examination. Yeah, and if you're really ambitious, it would be better if you had Polish because most patients speak Polish. So it kind of like cuts down on the translational barrier. But the thing is, if the students in your class don't speak Polish also, it kind of like creates a weird dynamic. It could, where like you're speaking to Polish to the patient and then the teacher translates, or like the patient understands it and then the teacher would just respond. And then like the students that are also in your year or like in your group, they won't understand what you just asked. So it's like, I mean, it's still good to know though, for sure, because especially when you're in internship, like in summer, it just is good. So like having Polish and like adding it there, because that's like a good base to have, just to be able to ask questions in those. It's pretty simple questions really in Polish, even if you don't know all the answers, but you get to practice that and you also get to see what the patient will say. But regularly, the patients will be speaking Polish, or maybe English if you're lucky, but the patients will speak Polish to the teacher will translate, and then you ask the question that you want to ask the patient to the teacher, and then they just ask the patient directly, which is okay. It works, you know. Yeah, and for the finals for each semester, I believe they have a practical and an actual theoretical. The practical comes first, where they're going to ask you a couple questions about history in the first semester, and then the second semester they ask you a couple questions about full body examination, where they want you to do something. All right, just like, so if you know the aspects of that history to be asking, and you know the specific sign, and you know how to do a specific aspect of full body examination properly, and even coming up with possible conditions where something might be wrong or right, something like that, what you hear, what you feel, what you see. For the finals, like at the end of the year, you're gonna have one exam for internal, and it's an exam for pediatrics for the theoretical stuff. And I would say pediatrics was a bit easier. You want to read all of the slides and old questions, actually. Old questions help, but for internal, they changed a lot more. And pediatrics is generally just a bit more simple because there are certain things that they're going to ask just because it's so characteristic for pediatrics. Unlike internal is more disease-based. It's just anything disease conditions, right? even though we were learning about full body examination, the lectures during the year, they were talking about conditions in internal. So it's more like pathophysiology in internal. And it's like adding things from, of course, full body examination and patient history. Like if you hear some heart sounds, things like that. Like I kind of should have focused more on that when I studied, but it was okay. Like the hard stuff, that's what I mean. I should have focused more on the hard stuff. But overall, I did well. I wrote notes, and yeah, most people passed. People still failed though, so watch out. Propaedeutics of Internal Medicine / Paediatrics. I think this should go in the wake up because it's a step above, and I think you should wake up. Make sure you study for this. Like, it's not easy, but it's okay. Read it once or twice, you're fine. Okay, now pathology or pathomorphology. I put this at a same place with pediatrics internal because it's similar in a way where you have lots of lectures, lots of seminars, and you have a couple presentations, but it's definitely easier in a way where it's like you study the book and you'll be fine. But it's not easy because you have to read the book a couple times, but you'll be fine in that. There's 3 tests a semester, and it's fill in the blank in my year, but past years it changes, I've been hearing. Yeah, it's not that bad. Just stay alert, read the books when they tell you to read it, read what they ask you to read, and also make sure you take notes in class so you get credits for attendance. At least in my year, that's what it was like. So it was nice, yeah. Classes where you learn about histology stuff, and then you see the pathomorphology, things that change badly, basically. And then you also get to see them under the microscope, and she explains it in detail. And then you also see some cases related to what you studied just then. And then you're able to figure things out and see some characteristic stuff for characteristic diseases. Some of my classmates say it's useless, but I mean, it's rare for you to be able to actually see the tissue, but it's good to be able to think about it in certain things. Like now I studied dermatology, so it's like those things are coming back up, but it's still like as a doctor, it's good to know what you would be looking for and what might have changed, like you can imagine it. So you can also see like, okay, what layers have been affected, but generally, I mean, I don't know. We'll see. I don't know. But I think it was fine. I like the class. It was okay. Yeah. Pretty studyable. Like, it was studying, you'll be passed. Like, it's not a hard study. It's like a good study. Like, you just read it and you understand it, you're fine. Okay, lab diagnostics. Lab diagnostics. Where will I put lab diagnostics? I think I'll put them in the same... No. Lab diagnostics is a bit above pathomorphology. Where did I put it here? Lab diagnostics. I put it in the same rank initially, but I think it's a bit different. I think it's a bit higher than that. Yeah. For lab diagnostics, I put it in a rank above everything else that we've talked about so far. Okay, yeah. So it's not horrible, right? You go to classes, you have lectures, you have seminars, and you can learn about the different aspects of the tests and the parameters, and then you're able to see the differences in like the ones that are important, and you also get to see the characteristic ones that you should know, and you get to see how they use it, and also you get to do some of them, mainly like seeing the micro changes inside when you measure things under the wavelength monitor thingy. I forget what that's called, but basically you get to practically be able to see some, even though it's fake, you get to see some fake results from a patient's tests, and then you also know what tests the patient should do, and you get to know what to expect or what to assume might be the problem based on the tests you've done physiologically, what might have changed from that, and also you get to predict what you might want to do, and you get to also see how like varied some tests are. You get to see how specific some tests are. You can see how general some parameters are and how specific some are. Right. It's very interesting. And you get to also see it kind of breaks some assumptions you might have had from, I guess, like media and just like your personal experience of what you thought certain things meant about certain levels and decreases and increases and how normal things were. Right. I'm kind of talking generally, but if you get my drift, you get my drift. Huh? So yeah, it's a very useful class. And the test is not easy. Right. I took a lot of notes, and I studied well for it. And for the exam, I would say use old questions, but just as a guide, don't use it as a studying thing because the test can be too specific. It's good, like they actually tested as well, but it can be very specific and things can change very easily. So study the slides well and take notes. I would assume is the best. That's what I did. That's what I'm saying. But do whatever you want. Just study. Okay, next is Pharmacology and Toxicology. Just Pharmacology, we call it. And this one was probably one of the top 3 hardest courses I've gone through between micro, I haven't talked about it yet, but this, pharma and biology / anatomy / it's like top 5, you know. I mean, it's hard to tell because like I've gone through it and like after I've done it, it's like, oh yeah, that was easier, blah, blah, blah. But definitely pharma was one of those ones because it had a lot of rote memorization, which I was not fully a fan of, or more I wasn't used to. I'm not used to doing rote. I'm used to more understanding things once I read it once or twice, and then boom, I can take a test and I'll do well. But this is like you read it once or twice and you sit with it with 3 hours, you won't understand it. You have to test yourself. You have to test yourself because it's just a random word that doesn't sound real. Like phenoxybenzenyl. Like, what is that, bro? Who is that? Like fluoro, blah, blah, blah. But like cytosine, like, bro, it just says anything. Like, it's just random words like amphotericin. What is that? And then you have to know multiple aspects about each one. So like usually at least 5 things, but there's definitely a hierarchy on things that are important. But that's after you've studied it and you get to see a big picture view. While you're in it, there's a lot of nuance and a lot of many things that seem important that you understand over time. But there's a lot of facts, let's say. In the finals, when I was studying, I had 1,000 cards after I failed once. Unfortunately, I failed once. I failed by 1.2. I failed by 1 point. That is crazy. You know what they did, actually? They lowered the passing mark to 51%, and I got 50. That's not normal. Usually the passing when like let's say I was in high school, right? The passing mark was 50%. So if you got 50, you passed. They made it 51. That was so strange. So strange. I failed by 1, so I had to study extra, which was good anyway. I got to restudy and I got to get better, review my drugs and stuff. It wasn't better, but it's better like overall. Yeah, whatever, right? It's not easy. And during the year, definitely I failed a couple tests, like my first try. Right. It's not easy, right? But people get through it, right? I actually think less people failed this than the subject I'm about to talk about. Yeah, the ratio of understanding to memorization is skewed like towards memorization, like heavily compared to the other subjects. But in medicine, you need a lot of memorization still. But this one is just way more. Yeah. Okay. So I put that in the, bro, I don't even know why I called this right here, but stand on business, wake up. Like, okay. So I put pharma is short for pharmacology. If you're new to the stream, pharma is short for pharmacology. By the way, if you're new to the stream, pharma is short for pharmacology.
Calculator for short chat. So, okay, 5. So you're saying 5 times 50,000? Yeah, you have to use a calculator. What do you guys not understand?
250,000.
Bruh, I know you have a calc in your hand, bruh.
This goes in the study like you don't pray and pray like you don't study category. It's the first entrant. Microbiology. This was a really hard course, generally based on the exams. The lectures were good. The seminars were good. The practical stuff was good. Like moderately easy. Like you have to study before classes and you have to answer some questions to make sure that you've been studying consistently. And if you don't, you have to make up the class. And you also have worksheets to do. Every single class you got to print out and you got to do some stuff to see other aspects of what you've been studying. Right? The bacteria, the diseases, the vectors, the specific tests, the specific diagnostic tools, the case studies in each one. And then also using microscopes and practicing being able to prepare the bacteria. Many, many things that more I haven't even mentioned. Like it's very well constructed. The classes were really nice. Teachers are competent really well. Like they can think of the different drugs and different aspects and they bring it out of nowhere and then you're like, what? And they can also make like fake questions. So like you're like, yes? Like you have to think. You can't just, you can't like just like act like you know, right? Again, they trick you. Which kind of makes it fun. I like it. It's more of an intellectual thing, but it's still memorizing, right? And it can become very granular because the slides in this course are actually the textbook. Like they're actually the textbook. Every single word can be part of it. And the slides are made well, but it's just, you have to make sure you memorize every single thing because anything can come up. So basically the exams were based on the 3 semesters that we had of microbiology. It started second year and it ended in the first semester of third year. That's when we had the exam. But now they do 2 semesters from what I've heard. And each test is pretty specific, so you just make sure you memorize. That's all I can really say. And especially focus on your weaknesses. On everything I've talked about so far, focus on your weaknesses. After you've read it once or twice, focus on your weaknesses and build on that at least. At least understand or memorize at least decent of mostly everything. Like at least. Like at least. Okay, so when it comes to exam, I'll be honest, I failed twice. But most people failed twice, if I remember right. Like more than 50% were in the retakes, including the Polish division. Like, yeah. And even after all that, I think by the end of the course, including the first, second, and third semester, at least 30% of my year failed microbiology. They had to retake it. I think that's the highest failure rate of any subject. I still don't think it was the hardest, but I think it was one of the hardest because the exams are so hard and so specific. Yeah. People still do well though, of course, but the majority of people were struggling. And the last one, microbiology, it also goes in the study like you don't pray and pray like you don't study because you need it. You need it. And that's it. That's all the subjects. Finished for third year. And if you guys want me to go through any of the subjects into more detail, I can do that. And also, if you want me to do the same thing for first year or second year, I can do that too. Let me know. Yeah, bye. Imagine if it wasn't recording this whole time.